We're giving you our top tips for surviving the cold and flu season. Our next question is an email from Susan in Northridge, California, and she writes, Dear Dr. Sears, my kids get the flu every year, and I always get worried when they get a fever. What temperature should I be worried about? When do I take them to the doctor?
First off, what's normal? When you first put the thermometer in their mouth or check it in their ear, it's going to be down, and it goes up to about 98.6 is kind of the average temperature most people have. That's not a fever. That's normal. Everybody's happy. Really good. But when it gets up to, up towards 99, 100, then you start thinking it's a fever. But do you worry or not? It depends on what the child is doing. If he's happy running around, even at 102, I don't worry as much. But then when it gets up into that range, do we worry or not? It really depends on what the child is doing. As long as they're happy and therefore eating and drinking, staying hydrated, we're good. If they're kind of grumpy, getting towards lethargic, then yeah, give a fever reducer, see if they improve their mood. And if they don't, it's time to call the doctor. Now, what happens when it gets over about 103? That's when you really should probably at least call the doctor, no matter what, just to kind of discuss these things.
And kids at that temperature, it's not that 103 degrees is dangerous,
No.
but they tend to get really fussy at that temperature.
Right. Now, when is a fever, the temperature itself, actually dangerous? Parents think, what, 104, 105? It's actually not till 107 degrees is when we see brain damage from the fever. Actually, that's very, very rare, hardly ever happens. Parents also want to know, what are the other things you can do for a fever? And you talk about, parents ask me about cold baths, things like that. A cold bath makes sense. You'd think it would bring the temperature down. But what happens? If you're running a fever, your internal thermostat is turned up to try to keep your temperature up at 103. If you reduce your skin temperature with a cold bath, what's going to happen inside? That thermostat's just going to get revved up even more, and your temperature may come down for a little bit, but then it's going to shoot right back up.
And the way it's going to do that is your baby or your child's going to start shivering.
Shivering, right.
Trying to increase its body temperature.
So if you're going to use a bath, we call it a tepid bath, almost like room temperature. Cool enough so it cools them down, but you do not want to see them shivering. Okay? Now, if we are going to use medication, there's actually some very important changes this year in how the fever medication is dosed. In the past, there's been, any parent knows this, there's been the infant concentrated drops, and then the adult, the older child liquid, and it was very confusing for the parents. So the FDA said to the manufacturers, you got to fix this, make it one uniform strength. So now they don't have the infant concentrated drops anymore. You'll see, even the bottles that are labeled for infants, this one says 0 to 36 months. It's the same strength as the older children are getting. It's just a different bottle, a different dropper. Also, they've made a few other safety improvements. There's a flow restrictor. So suppose the child gets the cap off, tries to drink it, nothing comes out. The only way you can get the medication is by inserting the syringe and drawing it out. Much safer.
This makes
it's about
us all
time.
rest easier.